Nearly half of all states are seeing a rise in COVID-19 cases. Many of those, particularly in the South and the West, are reporting more and more numbers of young people becoming infected. Beth Ward joins us live from her home, getting answers on how Western Mass is faring. Beth?
Well, Jordan, states like Florida, Texas, and California are reporting a surge in COVID cases, particularly among the ages of 18 and 34. So we decided to check in with Bay State Medical Center to see how we are doing here in Western Mass and to see if national numbers are reflected here in our area.
In the most recent data available by the CDC, nearly 70% of people in the U.S. who tested positive for COVID-19 are younger than age 60, the median age 48. In hotspots like Arizona, Florida, and Texas, health officials say the majority of new cases are people in their 20s and 30s.
The states that you are seeing there are having these kind of significant spikes in their daily cases, like Arizona, Texas, Florida. They all opened up completely as opposed to what we're doing here in Massachusetts.
The good news for Massachusetts, Bay State infectious disease Dr. Esteban del Pilar Morales says opening more slowly appears to be helping. The number of cases statewide and here in Western Mass continues to decline at every age level. The latest data from the Massachusetts Department of Public Health shows the average age of those infected is 51, although it's a tight race between 20, 30, and 40-year-olds. However, the average age of those hospitalized jumps considerably to 68. Deaths, that jumps again to age 81. But as the state continues to move on to each new phase of reopening, there is concern that many, particularly young people, will become apathetic.
We've been working and dealing with COVID-19 now for almost 5 months. And a lot of people get burned out about, is this really necessary? Is this really going on?
Bay State's Chief of Disaster Medicine, Dr. Gerald Beltran, tells Western Mass News, while the elderly are more likely to be hospitalized, young people are not immune.
We can't predict who that's young is going to have the really bad part of this disease where they may need to be ventilated or die. And have we seen that in Western Mass? Absolutely. I will tell you that almost every emergency physician in Western Mass has seen a younger person die from this disease. When I say younger, it's like low 20s, low 30s.
Which, he says, makes continued social distancing efforts critical.
Just because things are opening up, it doesn't mean that COVID is gone. It's still here, it's still with us. We still need to social distance as best as we can. We still need to wear our masks. We still need to do hand hygiene.
Well, in the meantime, Bay State Health, that encompasses all of Bay State Medical Center's hospitals in Western Mass, said that they now have 16 patients now hospitalized with COVID-19. 4 of those are in ICU. Reporting live from home, Beth Ward, Western Mass News.